So you'll see yourself here too?
Hi, welcome. Yep, we live. Hi, welcome to our P&C meeting principals report. This evening I'll be talking about managing illness at school in relation to both students and staff. I'll start with student illness. This time of year it's notoriously bad for common childhood colds, viruses, etc. And it's really important, I guess, as a community that we work together to help prevent the spread of any kind of viruses amongst the community. It has a serious flow-on effect and impact on others. Firstly, I want to outline that the way that we manage student illness is guided by infectious diseases policy available through the Education Directorate website, as well as first aid and general procedures that are also available on the website. I want to really discuss three areas around managing student illness, and one is around prevention, another around treatment, and then finally around the administration of medicine when at school to students. So in terms of prevention, I guess probably number one rule of thumb, if your child's sick, keep them at home. That is the number one way of preventing a spread to other students. So if your child has any symptoms such as fever, lethargy, or cough, persistent cough, any discharge from the nose, for example, at this time of year, that is a sign to keep them at home. Another way in which we sort of manage the prevention is by teaching children how to wash their hands thoroughly, and there are procedures around hand washing. Students are encouraged to wash their hands before, after eating times, and also toileting, so you can support that by making sure that you follow the same practices at home. Hand washing is a highly effective way of stopping the spread of any kind of germs. Another method that we use at school is around teaching children when they do have a cough how to cover when they're coughing, and the way we teach students to do that is by using the inner elbow and coughing in this manner as opposed to on hands, because hands touch everything and this is how illnesses spread. So if you're teaching your children at home when they do have a cough, it's to use the inner elbow as part of that procedure. We have sanitation procedures in our early years section that follows a prescribed routine for cleaning toys and anything that we use to ensure that that's maintained in the early years setting, which obviously is more susceptible to any kind of transmission because of the age of the kids. Nextly, I'll talk about the treatment. When children present with any kind of symptoms, they're immediately sent to the sick bay, in which we have dedicated first aid officers who are trained to manage the first aid part of any kind of illness. There is a registered kit with detailed information in line with the procedures and guidelines from the Directorate. But I guess when I'm thinking about parents' responsibility is to make sure that all of your contact details are up to date and that there are other people on your contact list who can be reached in case you're not contactable. Our first aid office, especially on the junior campus, can get extremely busy at this time of year, and we can't possibly keep students in the sick bay waiting, for up to an hour. Really, when you're contacted to help, I guess, minimise the impact is to get someone there to pick the kids up and take them home immediately. So that's a really important part of what we do to maintain, minimise the spread of infection. In terms of administrating medicine, sometimes kids have some time off. They're prescribed a round of antibiotics. And if they are not showing any symptoms and are able to return to school, yet they still have medicines that they need to take, it's important to know that parents are required to fill out the medication authorisation form, and it's a signed copy with details of all of that information. And our first aid officers are able, once consent has been given through the appropriate paperwork, to administer that medicine. Teachers do not administer that medicine. It must be administered by our first aid officers and stored in an appropriate space in terms of refrigeration, etc. So those forms are available on our school website if you're in a situation where you need support in administering medicine for children who are recovering from a period of illness. In terms of staff illness, the first thing I guess I want to mention is that yes, our staff do get sick. And generally our staff get sick from childhood illnesses that get spread around. So it really is important that our staff actually take the time off to recover from that, because if they don't, then they're spreading it to other people as well. It's hard to manage at this time of year, and we do have a set of established procedures to manage staff illness. And that really includes a dedicated person who receives a phone call, who then uses a central database in the ACT to call around and find casual teachers for that particular day. Where possible, that teacher who might be really quite ill at home will still send through a plan, if they're fit to do so, on that particular day to continue the program with the casual teacher. Sometimes our staff are too sick that they can't get that through. But they do everything they can, I guess, to be at school, and sometimes that means making a call early in the morning to our staffing officer to let them know that they really cannot make it, because they do everything to try and get in on the day. This process starts from as early as 6 o'clock in the morning. All the schools are feeding into the same database, and particularly in Gungahlin, where we have 3 of the largest schools in Canberra, we're sort of using the same pool of casual teachers. And I can assure you there is a known shortage of teachers, casual teachers across the ACT, and it has serious implications, I guess, for staffing in schools. I do know the Education Directorate are working on recruitment strategies to get more and more teachers into the ACT, but it raises some complications at a school level. This year, Gold Creek has actually dedicated a human resource manager to work with another staffing officer and executive teachers to really support our management of our human resources, our teachers, in this space. When we can't find a teacher, and I think this is the case, to come in and work casually, sometimes we have to make the call to split the class. And certainly during terms 2 and term 3, you'll see more of this happening. Really, that is because we just cannot get a teacher to cover it. So we try to split the class, especially in primary school, into the same year level in the first instance, because we know that the year level teachers will continue the program for those students. In the secondary, when there are split classes, our executive teachers actually assign work generally through the Google Classroom, and whilst the kids are split into other classes, they continue the work through their allocated Chromebooks and through our online platforms where possible. So that's what we, the initial procedures that we put in place when we're managing the illness of a staff member when we cannot get a casual teacher. I guess some issues that we're experiencing at the moment is that we have casual teachers booked, and often we get the casual teachers calling us and going, actually, I can't come in today because my children are sick. So, this again is creating more issues for us in managing that process, but that's why we end up having more split classes. In the event of long-term illness, and this happens, we have staff members for various reasons need to take extended periods of time off. Sometimes we know that there's an extended period of absence in which we can plan and book a casual teacher for. Sometimes the extended period of absence might start at a few days and then it keeps getting extended by a certain amount of days, which obviously can create issues to maintain the same teacher in the class covering. First and foremost, our number one priority is to have the same teacher covering the class to ensure consistency of the program. They work with the other teachers around them, be that a particular year level in the primary school or with their faculty colleagues in the secondary school to continue the normal program of work. Sometimes trying to get the same casual teacher is really quite challenging. Again, because a lot of casual teachers only work part-time days and they're not available for 5 days in a row. They're already previously booked with other teachers, and so this raises some complexities in managing that particular situation. As a school, our first and foremost, we look to ensuring the continuity of the program. Students are at the heart, and in those situations, what we tend to do, if that is what is occurring, we will put an executive teacher on the class, or we will get another staff member internally to take over that class for that period of absence. That practice is more so on our junior campus, where it's one teacher that manages that works with the one class. In the secondary, when there's an extended period of absence, we try to use some of our internal relief. We do have some teachers that have some capacity to pick up classes to cover that same class consecutively, or again, we draw on our executive teachers to step in that particular situation to manage that. If there is ongoing illness that we know about, that we will contact you and send an email to let you know that we've been made aware that this is going to be ongoing, and give you information around what plan we have in place to manage that particular situation. Again, we're really mindful. For us, it's around the consistency of the staff member for the students when that does occur. However, obviously dealing with humans, things change. When your child reports that they've had a different teacher or the classes have been split, I really just want to reassure everyone that first and foremost our priority is to ensure the continuation of the program, and we do everything in our power to get the same person in that space. And if we aren't able to do that for whatever reason, that we actually do look to some of our more experienced staff to step in and to ensure that we deliver the best that we can in the classroom. I guess from a school's point of view, in terms of to our parents and our community, for us, the best thing you can do to support this process is to really keep your kids at home when they're sick. We understand the pressures that you have at work and meeting your work requirements, but understand that if kids come to school sick, then generally that will impact our staff, and the staff will get sick too, and it impacts the operations of the school. So please keep your kids at home if they're not well, and if you are called to come and get them, know that the decision's not made lightly, and it's there to ensure that we prevent the spread of anything at school. Thank you.